Well, thank you, Julia, and good evening, everybody. It's nice to have some time with you. I appreciate this time. I know you have a busy agenda. I was just looking at it. It's always an impressive agenda, so I'll be expeditious with my remarks, but I do want to at least have some time to answer any questions that you have. I first, though, want to say thank you for what you do in the Graduate and Professional Student Association. I think that we all share a community here, a learning intellectual community that is made better by the contributions each of us makes. And I think students who are in student government organizations don't get enough thanks for the additional time and energy they commit to the university community through advocacy and action. And I just want you to know that I'm deeply appreciative of all the GPSA does. I've seen this organization grow in the time that I've been in this role, and it's really nice to see. And so thank you for contributing time that you don't have, because you're very busy people, even without this, but it means a lot to me and it means a lot to the university community. It feels like everything we're doing these days is COVID, and there's a way in which that's absolutely true. I was part of a small group that met this morning with Deborah Birx. You probably know Deborah Birx from White House briefings. She's a Penn State alumna, actually, and she was saying that she thinks that universities have unfortunately had to spend all of their time thinking about COVID issues, and it's distracted them at times from other issues, but she believes that a lot of the answers to the national problems are found within universities and how we are doing things, or things we're learning from what we're trying to do. And I'd like to think that's true at Penn State. I think that the COVID plans that were laid out were not universally supported, which is understandable. Nothing of that complication or importance is ever going to be universally supported. But I think that one thing that is notable about the plans is that they've actually held reasonably well through 8.5 weeks since we opened the residence halls. And there were a lot of people who said we wouldn't get this far. It's good that we have gotten this far. We have about 5.5 weeks yet until the declared end of the in-person experience, which of course, as you know, doesn't end the in-person experience, because even after November 20th, we will have many students who are living on campus, certainly many more students living off campus, and many services and programs that are in place now in person are going to have to continue to be in place and in person as we persist with this experience. It's also true even beyond the semester. We have students who are going to be staying here. They will need healthcare. They will need other kinds of services and programs. Our testing, contact tracing, quarantine, and isolation is going to have to persist. So we're in a mode here at the university where we are full on all the time with COVID and the response to COVID. And I think that's going to be true for the foreseeable future. But so far, things are going reasonably well. One of the things that Dr. Birx was complimentary about today was the messaging and communication. She thought that the university had struck the balance between carrot and stick relatively nicely, and she asked a lot of questions about compliance with our expectations. If you don't know, we have had, I think, 1,600 referrals of students to the Office of Student Conduct for COVID-related violations since the beginning of the semester. Many of them are fairly minor. A lot of them came out of the residence halls, where we have sort of a pseudo-custodial relationship and can observe violations of the COVID expectations. But many of them also are coming from off-campus violations of the ordinance and violations of our expectations too. We have had zero, though, and this is important perhaps for those of you who teach, have interactions with students in classrooms. We've had zero violations, at least the last time I looked, of COVID expectations in classrooms. So all these violations have occurred outside the classroom. Students seem to be complying with the expectations laid out for them in classroom experiences. We have, ironically, I think, had 3 faculty members who were violating COVID expectations in the classroom, and those have been addressed. But generally speaking, in the classroom and on campus, I think compliance with the expectations has been pretty strong. Off campus, I still would contend that the majority of students are complying as they must. We're asking all students to do things that are a little unnatural. Socializing with 20 of your friends in your house or your apartment is not an unnatural thing for students to do, but in the context of a pandemic, it becomes very problematic. And indeed, it becomes potentially a violation of local law, as well as the university's policies and practices. But I think despite the overwhelming majority of students doing their best to be compliant, we are managing to address instances off campus where there isn't compliance. I think that's going reasonably well. We actually have had to suspend some students. We've suspended, by my last count, 10 students for violation of COVID expectations. All of those violations occurred off campus. And we have asked 17 students who are living in the residence halls to leave the residence halls because of COVID violations. But I think, the testing, contact tracing, quarantine and isolation, all that meat and potatoes work that's really important has improved as we go forward. I think that we're all learning as we go to some extent. This is new for all of us, of course. We're getting better at contact tracing. So good, in fact, that there's now a conversation underway with the Department of Health about whether we would take responsibility for a larger share of local contact tracing. I think the Department of Health is overwhelmed, perhaps, with the burden that it has for the broader community. So we'll talk about that. Quarantine and isolation space. So far, it's holding relatively steady. We have plenty of capacity there. I think we're getting a whole lot better about how we provide support to students who are going through the quarantine and isolation. That is no fun for anyone. No one can want to be in quarantine and isolation, but it becomes very important that they are when the circumstances are such that they have to be. One of the things we're challenged with is students don't want to, when they test positive or otherwise have indications that suggest that their close contacts need to be quarantined. They don't want to impose that on their friends, and most of their close contacts are their best friends. So we're struggling with that issue a little bit, I think. But again, on balance, I would say that students are doing pretty well with all this, and I'm grateful for what they're doing. I think that the modalities in which we're delivering courses, that's been probably better received by most students than I thought might be the case. I happen to be the father of a new freshman at Penn State who has all of his classes remote. He's not altogether pleased by that, but he tells me with each passing week that it gets a little bit better, that the instructors are getting better at it, and the students are getting better at it too. So I hope that's true. We have plans that we're about to present in some detail about the exit strategy on the 20th of November. We're going to offer testing to any students who want testing before they leave. And we know, of course, as I've already said, that many students will stay here, and we will continue to provide support to them. We're also working on the details of plans for the spring. You've seen the schedule, I think. If you haven't, you can look at it, but we've pushed the opening a little later. We are going to have, I think, pretty robust activities around Martin Luther King Day, which is always important, but I think never more so than this year. But then we're going to launch into the semester in a delayed fashion and allow ourselves to do some of the testing that's necessary before we return, and to phase in the return into residential experiences on campus in the spring the way we need to. We're not going to have a spring break. That's pretty common across the country. Most schools have gone to that strategy because you don't want to have people leaving town and coming back and having to reset everything. So instead, we're going to have what are called wellness days, I think. We're going to have a few scattered throughout the semester. I don't think we've quite determined exactly what those look like. I would be one who's advocating for, and I welcome whatever you have to say about this, I would advocate for those to be assigned as full days off, basically for the university community, as opposed to letting individual faculty members decide how they're going to allocate those days for their individual classes. I think that will not meet the need that is intended for wellness days. So I could talk a lot more about COVID, but I'm going to pivot to another issue that I think is critically important, and that is all the conversation about racial justice, social justice more broadly, but certainly racial justice is the focus. It is a focus here at the university. It needs to be. I think advocacy from student groups like yours and student government around these issues is always important, but this is the moment, folks, and we need to step up to it and make a difference now. A couple of things I call your attention to if you're not aware of them. President Barron had created a commission, a university commission, to address some of these issues, and that's a group that has presented some preliminary recommendations. I think if those are not public yet, they will be public relatively soon, and I hope that GPSA will take the time to comment upon those recommendations. Of great importance to me is another group that came about because of some hate speech that occurred before the school year began, and there was concern that the student code of conduct was not sufficient to meet issues related to hate or racism in our community. So a task force was formed to review the code of conduct that affects all students, and I think that's another set of issues that GPSA should take up and offer some comment about. The preliminary recommendations are just coming forward. President's Council, which is the senior leadership group, will be talking with the chairs of those groups next Monday, I believe. So we're just starting our deliberations about these things, but I hope that you will engage in that conversation too. A third issue I want to mention to you is the elections. It's unfortunate that we can't be in person more, because I think this would be a time of great civic vibrancy among us. And while I think there's plenty of activity and interest around the elections, there is less obvious overt engagement in these issues that are of such importance to all of us. That may change in the coming weeks, I don't know, but I hope that all of you and others like you take the time to be registered to vote. Registration in Pennsylvania, the deadline is rapidly approaching. I think there are only about 5 days left to register, but then I hope people get out to the polls and actually participate. Students have an opportunity always in elections to impact local issues. That's sometimes more critical in some elections than others, but I do want to close by saying this and then open myself up to your questions and comments. This is a small town, State College, and the surrounding communities. It's a small municipality. Students are a very large percentage of the population here. You have it within yourselves, actually, to influence local affairs quite markedly if you choose to organize yourselves collectively in the way you could. I think that the student interest is something that needs to always be prominent in the consideration of local policy, law, practice, and the leaders of the community should reflect, I think, students where possible, but they certainly should hear from students and should reflect student interest in the actions that they take. So I encourage you to encourage your peers to be as engaged politically, locally, as they possibly can be. The only other thing I want to say, Julia, very quickly, is since Claire's here, Claire, as many of you know probably, is the chair of the student-initiated fee committee at University Park, and it's a very important role. Claire and that committee have a lot to say about many millions of dollars and how it's spent on behalf of students. I hope that Claire keeps you apprised of how that group is going, but you also should contribute your thoughts about the activities that that group feeds with the resources that are available to it. It's another example, I think, of student involvement and institutional decision-making at Penn State that's critically important. So Julia, if it's okay with you, I'll just open it up to anybody's questions or comments.
Yes, thank you. Are there any questions for Damon? Amma?
Hello, Dr. Sims. Thank you so much for taking the time to come and speak to us. I really appreciate it. I just wanted to, I was curious, statistically speaking, when I went to the dashboard today, I read that the university is testing 1% of the student population. And I know that a lot of decisions being made are based on the results of these testings. So I just wanted to know, statistically speaking, how is 1% representative of what is happening on campus with the current student population as a whole?
Yeah, well, that's a very good question. And I don't know, Julia, has this group heard from Kelly Walgast? Have you met with Kelly
No,
Walgast?
she's going to speak with the assembly on November 11th. Alex and I
Okay.
had a meeting with her. But.
Okay, I mentioned that, Amma, because Kelly Walgast is the leader of our Coronavirus Operations Control Center. She can answer your question probably better than I can. I hate for you to have to wait till November 11th to get an answer. I would say that the 1% strategy was something that was talked about a lot through the summer. The scientists who were involved in developing that were several at the university. We had epidemiologists who are at the university who helped develop that strategy too. So the surveillance testing, is linked with the symptomatic testing, the on-demand stuff, and it's just one part of a broader strategy. They did an analysis that, from their perspective, made the 1% sufficient. You and I know that there are others who see it differently. It is admittedly the case that at some institutions they are testing more robustly than we are. I don't know whether their outcomes are different from ours, but we have stuck with the 1% pretty rigorously. We've had to rely on third parties to do some of our testing, or our analysis at least. So we've had that partnership, which has created further complications. Of course, it would be nice if we got all of our test results as quickly as we could. We haven't always gotten them as quickly as we would like, or as we had expected, which also complicates things. We're in the process of creating a CLIA certified lab at the university that would speed everything up and perhaps improve our capacity for doing the testing ourselves. We hope that's the case, at least. And I think by the time you have a gathering with Kelly Walgast, she ought to be in a position where she can answer some of the questions about whether we're going to be able to expand the 1% in any meaningful way, and if so, how we're going to do that, and how precisely it helps if we can bring most of that activity in-house as opposed to relying on third parties to do the analysis of our tests.
Thank you so much.
Thank you.
Nico?
Hi, Dr. Sims. I've enjoyed hearing what you've had to say. I do have sort of a concern that is related to a question. So I've heard from other students that when referred for random testing, if they indicate any symptoms, they are told that they're, or maybe it's some particular threshold of symptoms, they're told they're not eligible for the random testing. That destroys the validity of the sample. Yeah, sorry. That destroys the validity of the sample. It's no longer a random sample if you're excluding everyone who's more likely to have COVID. So are we trying to survey the asymptomatic population or the population? Because those are going to give different results. And I'm concerned that we are not getting, or at least not getting on the dashboard, accurate information because of that discrepancy.
Yeah, well, I hate to do this to you, Nico, but I would say that's another Kelly Walgast question. The students who are symptomatic, who are selected for the surveillance testing are then sent to the University Health Services. So, you know, that's where we're doing symptomatic testing consistently. We have the setup over there to manage that so that we don't contaminate other people with a virus at the testing site. And so when you are symptomatic, you're supposed to go to University Health Services. The surveillance testing is done differently, but I understand your point. And I think that it's something that you're going to have to raise with the scientist. I'm a lawyer, I'm not a scientist, so you'll have to raise it with them about whether that does spoil the sample, or if it changes the statistical analysis in any way that's really meaningful. I think, for what it's worth, the dashboard, I'd love to hear your comments about this. There are 4 key metrics I look at with all this. One is just, you know, what are the results? What's the prevalence of the disease in the community? Another is quarantine and isolation space. Do we still have capacity there, or are we overrunning it? A third is the local healthcare system, particularly the hospital. We have 1 hospital for this community. Is its capacity still strong, or are we jeopardizing it in some way? And then fourth, is there evidence of community spread? Is the transmission more than just student to student? Is it now student into the broader community in some meaningful way? And there are a lot of other data points on the dashboard that I know are important and of interest to people, but I think those 4 that I named are the key ones. And I think it would help all of us if we focus as much attention on those as we possibly could, and that we even highlighted those a little bit better on the dashboard. That's my comment about the dashboard. But I think Kelly can answer a lot of your questions in some specificity about the dashboard, about the analysis that we're doing and how we're using it to make some judgments going forward. But as you know, the other thing I'd say is that it is the collection of all that, not a particular number that actually matters in terms of decisions for the what we call off ramps or on ramps even.
If I could ask a follow-up, do you know if there is a threshold for the intake testing for the spring semester that would prompt the university to go more remote or fully remote?
No, I don't think there is. I mean, there is no number. Eric Barron keeps saying this to us and to others. There isn't a particular number. It is the sum of things. But I think those 4 factors that I mentioned are the key factors. So they do include, you know, what is the prevalence of the disease within our community? What do those tests show us? What do other analyses like the sewage testing, what does that show us? And then the capacity at quarantine and isolation space, the capacity in the local hospital, and whether there's community spread. And so far, there isn't strong evidence of community spread. Most of the numbers are students infecting other students, and most of that is happening in, you know, households. You share an apartment with 3 or 4 people, you share a house with 3 or 4 people. That's where the transmission is occurring repeatedly, and it's often happening in asymptomatic ways. We heard today from Dr. Burks that for the 18 to 22-year-old population, they now believe that of those who are positive, 80% of them are asymptomatic. That's a tough factor to contend with. Even in nursing homes, 33% of those infected are asymptomatic. So that situation is going to create additional challenges as we go forward.
Sandeep?
Hi, Dr. Sims. So I have a question about the access to testing after the switch to online instruction in November and over winter break. So will students who aren't able to travel and who stay here in State College, such as international students, still have access to testing facilities?
Yes, another good question. So as I said, any students, these are not the students you're referencing, but any students who do want to be tested before they leave can be tested. And then we are going to continue to test beyond November 20th. In fact, I had a discussion today about a circumstance that will be unique, I think, in the history of the university. So even after we get through the semester, between November 20th and the end of the semester, when we get to the break, there won't be a break for functions like the University Health Services, the testing that's done there, the quarantine and isolation space that will have to continue. People will be in it. The contact tracing that's necessary. We're thinking through what the continuity of operations will need to be, because we anticipate we'll have a great many students, international students and others, who will have to stay with us, and we need to provide them more than just room and board. We need to provide them other services to make sure that's successful and safe. So we're going to be continuing those services, not just through the semester, but through the holiday break, and then into the spring semester. So there will be no break for some of my colleagues and I.
Stephen?
Yeah, so my question revolves more closely as we get closer and closer to Thanksgiving break. And my understanding of after Thanksgiving is that when the university transitions to full remote education to help mitigate the spread of COVID-19. And I'm trying to understand, or my question to you is what steps can or what preparation is the university making, especially for us graduate students who are TAs who will be able to help with this transition after Thanksgiving break?
Well, I think my assumption is that your academic departments, I mean, if you are TAing, you're helping with courses, then you are going to be part of the transition to remote learning. And if you haven't done that before, some of you may have done that in the spring, where you aren't doing that now. Some of you may be doing it now. Some of you have a hybrid modality, and it might be relatively easy to switch to a full remote. We went through this though once, sort of right out of the gate without any real preparation back in the spring. And so we are hopeful that academic departments and the other support that faculty and instructors need is going to be a little more robust this time and in place, and people are going to be better able to make the transition, and that students are better able to make that transition too. I was looking at the percentages of classes that are really fully remote, and it's a pretty high percentage now. So, most of those classes will just continue to be remote, of course, but we're hoping that this transition will go relatively well. It's a relatively short period too, because we could quickly get into finals and other things beyond classes. So we're hoping that it won't be too problematic for too many people. But I hope that you have the support that is necessary to do that well.
Allie?
Great, thank you. This may be a little bit out of the scope of student affairs, but it bounces off of Stephen's question. I'm curious how particularly the hybrid classes are being assessed and kind of evaluated about whether that's a useful practice for next semester. Because I'm thinking about some of the experiences that those of us who are either TAs or graduate instructors of record are having in those hybrid classes where we have to go to campus to teach. But some of these classes are down to 3 or 4 students who are willing to come into the classroom, and the rest are engaging fully remote. And so the reality of graduate student instructors having to take the risk of going on campus, perhaps not driving and having to take the bus and all sorts of putting themselves at risk for that when a rapidly dwindling number of students are actually attending their classes. And so I'm curious, as the planning is in place for the spring, how is that being assessed? What are the conversations around whether the hybrid format is working for us?
Yeah, well, what I know is it is being assessed. So there's a group that's led by a couple of my colleagues, Yvonne Gedalius in undergraduate education, and Renata Engel with World Campus. They were tasked with leading a group that was in part intended to assess all modalities, really determine how well this has gone, where we can make improvements. So they're in the midst of all that now. I think they were surveying some students. They were also supposed to be surveying some faculty and instructors about that. I would hope that graduate students who are teaching are part of that effort. I might pass this along. It's interesting to me. I had heard the same thing, Allie, from some of my son's friends just the other day, that they just aren't going to the in-person experiences offered to them anymore. So I was starting to wonder about the instructors. And so you're right. If you're down to 1 or 2 or 3 students who are doing that, the proposition becomes a little different, and people have to be asking the question: is it worth the additional risk in various ways, or should that be a class that just reverts to full remote? And I hope that the analysis that's being done will inform that. But our whole idea in this has been to assess everything we're doing, to try to figure out what we have to do differently, how can we do it better, where are things working, where are they not working so well. A lot of this is a risk analysis, and so what is worth continuing given the additional risks. And I think as we go through the fall more deeply and into winter and return at a winter time, all of these issues about the risks involved become a little more acute, because everything goes indoors in a way, and we have to be very thoughtful about how we interact with one another, and that asymptomatic aspect of all this complicates it further, as I say. So you raise a very good point that I'm going to pass along to my colleagues with a question, and then I'm going to follow up with you, if that's okay.
It'd be great. And one thing, if you don't mind, Julia, that I would add in that too, is that I know some departments, when graduate instructors have gone to their department saying, I have 2 students, 3 students, whatever, small handful who still come, can I just go fully remote? They're being told, no, you can't change format. We have a quota, or we have a certain percentage of our classes that need to have some sort of face-to-face component. And then the graduate instructors who are in this boat find it interesting that the bulk of the folks teaching those hybrid or face-to-face classes are contingent faculty, graduate instructors, pre-tenure folks. And so there's a concern about equity and power dynamics and who is still being forced to go to campus.
Yeah, it's easy to understand that concern.
Yeah.
Lauren? Hello.
Hi.
Thank you for all of the information that you have shared today. My question is inquiring about the potential of at-home kits getting sent home for the beginning of the spring semester, like how it occurred in the fall semester. And if that was going to be occurring, if there is a better plan in place, because it seemed like there was quite a few of the kits that were not arriving. For example, my kit for the fall did not end up arriving, and I had to do the on-campus testing, which is okay. But if that happens, you know, in a large volume, then that becomes problematic. So I was just inquiring about if the university has a plan for repeating that system for the spring semester, or if there's any plan on improving it.
Yeah, well, we are going to do that again. And as I say, everything we're doing, we're trying to improve. I think that was one of those situations where, again, we were relying on a third party that was involved. And we'd like to think that since it was one of the initial things we did out of the gates, that maybe it was flawed in part because it was just the first time around, and even the third party was perhaps unusually burdened because there are a lot of other institutions that party had a relationship with, and they were trying to do the same thing at the same time. We have made plain our dissatisfaction with how that went and our insistence that it be done better. We have more lead time this time, frankly, to figure it all out and to learn lessons from that first experience. So I can only promise you that we are trying hard to make sure that the problems that you and others face, Lauren, aren't faced again, at least not to the extent that they were this first time around. I think given the volume, the size of the student population and the faculty and staff at the university, we're always going to have some problems. And so there will be outliers, I think, no matter how well we do it. But there were too many of those examples this first go around. We need to do all we can to make sure that doesn't happen again. So I appreciate your concern.
Thank you so much.
Thank you.
We can take one more question if there is one. Matt?
Great, thank you. Hi, Dr. Sims. Thanks for joining our assembly meeting. I want to sort of echo Sandeep's previous comment about students who will be here during the break after November 20th. A lot of graduate students, while coursework, may go fully remote at that point, research continues on campus, and that is what I think a large constituency of our constituency is the situation we'll be in. And so will the 1% surveillance testing be specified to the people who are still on campus, or will there be people who leave campus who will be requested to have surveillance testing done? Is that what's the plan, I guess, in ensuring that the 1% testing continues with the people that are still here?
Yeah, that's a great question. And I don't know the answer, actually, because to some extent, we will know who's gone. If you live in the residence halls or something, we'll know you're gone. We're not going to know who's here and who's not here, not just graduate students. There will be some undergraduate students who have leases and apartments and they'd rather just stay here than go home, or their families would rather that they stay here as opposed to go home. So it's a good question, because we don't know exactly who occupies the inn and there, and so sorting that out to make sure that we still are doing 1% or better is very important. But I know our intention is to do the testing because we know that a great many people are going to remain in the community, and we want to keep the virus at bay to the extent we can. So that's another question that you need to take up with Kelly Walgast, who would have the answer, I think, by November 11th, if that's what I understood when you're going to be meeting with her. They ought to have a plan in place there that she could present to you with some specificity, Matt.
Okay, yeah, thank you very much.
Yeah.
If something is not in place at that time, that does not give a lot of time for a plan to be put in place, which is why I wanted to voice my feelings now. Is it possible some sort of survey could be done to get an idea of the students that will likely be on campus at the time? I mean, even if it's not an official, thing that everyone necessarily has to participate in, if it was something that was optional to get your name in the hat to be randomly tested, I don't know. Again,
yeah, well, that's a thought. We are thinking about a survey. So this continuity of operations issue is affected by volume. How many people are going to be here? How many people are going to need all these services that we're talking about? And so this meeting today, we discussed that a little bit, and we have thought about sending out some sort of communication to students at University Park, asking them some basic questions. The first of which may be, do you plan to be here post November 20th in town? And do you plan to stay beyond the end of the semester through the break? I think that kind of insight would be very helpful to us. Even if it's not fully accurate, it would give us a better sense than we have right now of who's going to be here.
Great. Well, thank you very much for the information and joining us.
Good questions.
Thank you
Julia,
so much.
I overstayed my welcome. I'm sorry.
No, it's okay. Thank you for taking the time to answer all of those questions. We really appreciate it. We know you have a very busy schedule.
It's all right. Good to see you guys. Thanks very much. Bye-bye.
Thank you.